Welcome, everyone, and thank you for tuning in. In honor of Martin Luther King's National Day of Service, we're excited today to welcome you to Exploring the Positive Impact of Volunteerism. My name is Dr. Shayuri Turner, and I'm the Chief Health Officer at Crisis Text Line. I'm an internist and pediatrician with a background in trauma and public health. I'm also the mother of two young adults, and I currently lead the public policy and advocacy team here at Crisis Text Line. Now, for those of you who don't know us, Crisis Text Line is a free 24/7, high-quality, text-based mental health support and crisis intervention service. We serve texters who are going through any difficult or emotional situation from the ages of under 13 to over 65. It's basically for anyone in need. We say that a crisis to you is a crisis to us. We're able to do that because of our tremendous volunteers who are people who have taken our training and spend their time supporting other people in crisis. In fact, we have trained over 65,000 volunteers who have all completed 30 hours of online training to bring their empathetic skills to life. We provide this service in both English and in Spanish because we are bilingual and bicultural. We can be reached by texting HELP or ayuda to 741-741. We're also available on WhatsApp and web chat. In 1994, Congress passed the King Holiday and Service Act, which transformed Martin Luther King Jr. Day into a national day dedicated to volunteer service. MLK Day has grown as more Americans are encouraged to provide meaningful service and volunteerism. So this is an opportunity for us all to unite in service to help our communities prosper and thrive. So today I am joined by Nuria Santamaria Wolf, Crisis Text Line's Senior Vice President of Volunteer Experience. She and I will discuss the benefits of volunteerism and its impact on others, as well as on our own personal well-being. Nuria, welcome. Please introduce yourself, share your background with our guests so that they can learn some more about you.
Thank you, Dr. Turner. It's really wonderful to be here with you today, celebrating this wonderful day. A little bit about me. I am a professional at the intersection of technology and social impact. I've worked in this space for a number of years. And I'm also, very interested in issues of mental health. And that's actually one of the reasons that led me to join Crisis Text Line as a staff member. And I actually began as a volunteer. I speak English and Spanish and joined as a bilingual volunteer, really wanting to help my community. And as I learned more about the organization, as I went through the training itself, I was impressed by the quality of the training. I was impressed by the impact that volunteering had on the texter community. And I, really just was very interested in joining the organization itself. And so now I'm the Senior Vice President of Volunteer Experience, and I lead a number of teams, including our volunteer training, our volunteer coaching, and our volunteer community team. So I'm very excited to be here and talk a lot about volunteering with you today.
Thank you. And we are very excited to have you here, Nuria, both for this discussion today and at Crisis Text Line. You bring such a wealth of experience, and your leadership, even already in the short time that you've been here, has been phenomenal. So we're going to jump in and do some questions and answers with each other just to give our audience a sense of volunteering and what volunteering at Crisis Text Line means, and just the benefits of giving to others on this day of service and throughout the course of the year. So let's get started. Nuria, there's a lot of research and data about the benefits of volunteerism, and I'd love to get your perspective on this. So what are some of the ways that volunteerism helps individuals grow, both personally and professionally?
Yeah, absolutely. And like you said, there's so many benefits to volunteering. And obviously we think about sort of the end, receiver of that service, and that's really important. But it's also really beneficial for an individual to volunteer. We see people develop a really deep sense of purpose, develop a community around their volunteering, service. But when I think specifically about our volunteers, given the nature of the work that we do, given the nature of the training, we see our volunteers develop skills like, active listening, empathy, risk assessing, de-escalating, collaborative problem solving, and just all of these really wonderful skills that they can apply, obviously, when they support our texters who seek us for support, but also they are able to transfer those skills into their personal life, right? So they use that to become a better parent, partner, friend, etc. And, they also can carry those skills into their workplace, into their professional lives, right? So they might be improving their skills in building the relationship with their coworkers, or being able to listen more actively to their customers. So there's so many ways that those skills apply both in a personal space and a professional space. So our volunteers really take away so much from this experience.
I absolutely agree. I really think that volunteerism can serve as a transformative journey for many individuals because it fosters that personal growth, professional growth in such a myriad of ways. And people don't even really realize what the impact of volunteerism will be on their lives. But we do know that for many years, our volunteers have been telling us, like you said, that the skills they learned at Crisis Text Line have had a profound ripple effect on their communities, their families, their careers, on society. They tell us amazing and true stories about helping to de-escalate strangers struggling at the supermarket, or supporting their children who are being bullied in school. So they take the elements of our training, in addition to supporting texters on the platform, they're able to support people in their real lives. They support friends going through parenting challenges. And in addition, our volunteer training has provided pathways of skill building and professional development for aspiring mental health professionals, which I think is phenomenal, because we know that there is a workforce shortage and not everyone is going to become a mental health professional, but to have our training and the experiences on our platform lead or encourage or pique the interest of an individual so that they may ultimately pursue mental health as a profession is just astounding. So I'm going to turn it over to you.
Yes, Dr. Turner, we know that our volunteers feel very empowered, in the work that they do, especially learning skills like always ask. So I would love to hear a little bit more about what that is and why you feel like that's so important.
Yes. So our volunteer training contains a module or a component that includes a technique called always ask. And the premise is that anyone, whether you're a mental health professional or otherwise, can ask someone in a clear and kind manner during the course of a conversation whether they are having thoughts of death or dying or harming themselves. And it's about that active listening skill. So recognizing and reflecting to someone, say, for example, it sounds like this experience has been really devastating to you. In many instances, this could cause a lot of stress. Are you having thoughts of death or dying or hurting yourself? And noting that someone doesn't seem to be doing well and asking them directly is the always ask, because what it does is it takes away that obstacle of sitting with someone and telling them out of the blue that you're having thoughts of death and dying. This way, that person who may be having those thoughts realizes that they're not alone and someone really sees them. And what many people fear in the course of a conversation like this is that they're going to cause someone to start having thoughts of death or dying, or to harm themselves. And that is absolutely not the case. There's enough data to support that, in fact, you're decreasing that barrier, that sense of loneliness. You're not causing someone to want to take their own life or harm themselves. What you're doing is you're demonstrating that you care and saying to someone, I'm here with you. Let's help you get the help that you need. And the most important thing that we stress is you do not have to be a mental health professional to check in with people in your life in this way. Doing so can actually make them feel like they're not alone. So, Nuria, what have you heard directly from our volunteers as it pertains to this?
Yeah, absolutely. And we hear stories of impact like this every day from our volunteers. Truly, we do. And one example that really has stayed with me is an example of a volunteer who was going through our protocol of always asking the texter about the risk of self-harm, risk of taking their life. And the texter began to share what their thoughts were and how they were thinking about going about hurting themselves or taking their life. And the volunteer went through our protocol, went through our training, went through the assessment, and eventually the texter said, okay, I won't take my life. And that moment really happened as soon as that texter understood that the person on the other side of the text was a real human. And I think sometimes we hear that from some of our texters, feeling that this is an automated service, and it really is not. There's a real caring human on the other end. It's a complete stranger, but someone who really, really cares about supporting people in their time of need. And as soon as that texter really understood that there was a stranger somewhere in the world that truly cared and was there in that moment, it really was everything that they needed to hear to really change their perspective on what was happening in that moment. And so hearing that, hearing, a texter say, okay, I won't take my life. I didn't know that there was someone out there that cared about me so much. That's a really, truly powerful moment. And we hear our volunteers experience that every day on the platform. So it's truly impactful work, and it does save lives.
Yeah.
And we
I just want to, oh, go ahead.
Yeah, we hear that on the platform, right? We hear, the technique of always asking leading to, possibly saving a life, but we also see, like we mentioned before, volunteers really taking those skills into their personal life. And so we hear a story of a mother who had been a volunteer with us and knew to always ask, and actually started to take that technique into her own home with her daughter who had been having some struggles, and did ask, and then was able to identify that there was a need to provide support for her daughter who was in a really, really tough spot, potentially saving her life as well. So we see that impact on the platform as well as off the platform.
I can say personally, I have encouraged friends, family members to use the always ask techniques. And it always helps to give them sort of that framing of how to say it, right? Like this is how you can actually say this and encourage someone with whom you're speaking to answer that question, to not feel alone. So I can say personally, like I have used it and it really does work, and it's meaningful, and it's not as difficult as one might think. Once you can even practice the phrases and incorporating it just clearly and kindly and matter-of-factly into a conversation. So it's always great to hear the stories from our volunteers and how they've implemented Always Ask.
Dr. Turner, I'd love to hear how you volunteer in your own community and what your plans are for volunteering and acts of service in 2024.
Yes. So, in addition to our platform, throughout the year, I mentor students at all levels with their career development. I think it's so important, especially as a woman of color, to support other students, medical students, mental health professionals, anyone who's looking for enhancing their career and finding satisfaction with their career. I really enjoy kind of leaning back and helping folks do that. I also serve on the board of an organization that helps people who've been wrongfully incarcerated. So my plan for 2024 is to really continue leaning into the work around people who have been incarcerated, because we know the connection between mental illness, mental health, and incarceration. But one of the things I'd love to say and encourage people is that sometimes we feel like volunteerism has to be super specific or highly architected, when in fact it doesn't. It's volunteerism can be really just simple acts of service that we perform on a day-to-day basis that help others in a meaningful way. And we just need to be intentional about it. So my goal in 2024 is to really step up and kick up my volunteer service in the areas that I enjoy, so that I can bring that enthusiasm to others. So what about you, Nuria?
So my volunteering efforts have really been focused on serving underserved communities, especially immigrant communities. I'm an immigrant myself. I came to the United States from El Salvador, and so helping families who are at the border, immigrants at the border. Sometimes they're families with parents and kids. Sometimes they're unaccompanied minors. I've focused my volunteering efforts with those communities through a number of organizations, including Save the Children. And I did that volunteering work with my husband, who has now joined the board of Save the Children. And so our plan for this year is to actually go on a family service trip and bring the kids along and really expose them to volunteering and to service. It's really important for us to do that as a family unit. So we'll be doing that this year. And then personally, like I mentioned, I am a bilingual volunteer, so I'll continue to support our texters and make sure that I'm doing my part there.
It's wonderful to hear that you set the tone of volunteerism, the acts of volunteerism with your family, Nuria, because I think as children see that, they feel the benefits, they feel the reverberation of positive feelings that you have in helping others. So it's wonderful. I remember when my children were younger, we used to volunteer at a homeless shelter and serve people who were in need. And it really becomes very meaningful to both to see how other people live, but also to extend yourself in that way and just see the gratitude and appreciation that comes from others who receive this support. So thank you, Nuria. This has been a great conversation for us to have here on MLK Day, National Day of Service, and throughout the course of the year, because again, it's not just about the efforts and the volunteerism today, but it's about every day and the opportunity to serve others. But I do want to thank everyone who's joined us today. We are in the middle of a mental health epidemic, and our youth in particular are struggling. So you can be a part of the solution to our current mental health crisis by helping us support individuals in need. You can make such a huge impact by volunteering as a crisis counselor. Just visit crisistextline.org/become a volunteer to learn more and apply. And remember, if you need support, you can text us as well. Anyone can text help or Ayuda to 741-741 and receive support from our volunteer crisis counselor. So thank you, Nuria. Thank you, everyone. And we will see you next time.